warm welcome on behalf of Diabetes Awareness and New Day. Hi, I'm Adrita. I'm the dietitian and the diabetes educator of Day, and it is my pleasure to introduce our today's esteemed speaker, Dr. Nandu Krishnan. I welcome you, sir. Dr. Krishna is a public health specialist with an MD in epidemiology from the Institution of All India Institute of Health and Hygiene, Kolkata. He currently serves as senior consultant with the ICMR-funded DGI care project with the GPMAR, under the GPMAR, and focusing on the use of digital technologies for the prevention and management of diabetes and hypertension in the public healthcare system. He has also worked with the National Health Mission as an IDSP medical officer and has contributed in the field of digital health. Diseases, surveillances, and program evaluation have been recognized for our. And his every work have been recognized through the awards, conferences, presentations, and also publications in multiple international journals. Today, he will be speaking of the topic empowering diabetes prevention and management with digital technologies. Let us warmly welcome you, sir, and please over to you, carry forward the session. Thank you so much.
A very warm welcome to all the viewers to this session on empowering the diabetes prevention and management with digital technologies. So I would like to share my screen now, Adrita, if that is fine.
Yes, sir. Please share. Visible, sir.
Yeah. So as the golden era progresses, we are all becoming digital as we move daily. There are new technologies coming in. There are new progress coming in, smartphones. There are different types of, everyday technologies that we are in touch with. There is smart watch to smart sensors to everything we speak. There is some kind of electronic digital technology that is a part of our life. So it is high time that we start talking about something which is diabetes prevention and management, which can be done through digital technologies, and we should empower ourselves and the communities. As public health specialist, I personally deal with a lot of digital technologies, and we are, as an public health specialist in India, we are focusing a lot now in digital technologies. So without further ado, I'm going to start the session. So I'm Dr. Nandu Krishna J. I'm a public health specialist and epidemiologist by profession. And today's session overview will be basically about what is the current diabetes burden in India, how the digital technologies can be utilized to empower ourselves, what are the available digital tools which are used for prevention and management in diabetes. And I would be talking a little bit in depth of how we could utilize the digital platform eSanjeevani, which is the India's telemedicine powerhouse. And then I'll talk how we could empower the community, empower ourselves with these digital tools, and the challenges that are existing and how we could overcome them. So first of all, coming to the diabetes burden in India, as you can see in the map, the southern states and eastern states are the most affected with the diabetes right now. And as per the ICMR India B study in 2023, almost 10.1 crore Indians have some form of diabetes. And the NFHS 5 report has shown that 1 in 3 households in India has at least one diabetic member in their house. So this is a very alarming situation that we have in India. And in case of diabetes, the early detection, which is the most important part, which can prevent 50 to 70% of the cases, and it can delay the progression of the disease also through lifestyle changes. So what is the major gap that we have right now? It is urban or rural deficiencies in the digital literacy, in the digital technologies. And we have also seen that there is a rising rural diabetes cases that is occurring not just in India, almost all countries. And this is very well seen in the current latest studies also. So moving further, so how can we digital technologies empower ourselves or empower us with the diabetes prevention? So it can help us track, it can help us advise, and it can also help us connect with those healthcare service providers. So this digital technologies in the fingertips have helped us not just to prevent, but also to manage diabetes through different ways, like awareness applications. There are risk calculators for your diabetes, and through management we can monitor, remind us of what is the current status. There also are technologies through which we can do the remote consultations. So why should we specifically say empowering ourselves? Because these technologies have become affordable now, and these are accessible anytime, everywhere, and these are very user friendly. And moving forward, these are all tailored to our Indian lifestyles, which is very important when you're talking about a rural side of the technology. So going further, we have different types of digital tools for prevention and for detection. So for prevention, the early detection parts comes in, like you have applications which basically helps you track your calorie, calculate your risk score, where you are standing in the diabetes score, your meal logging, how much in calorie or how much meals you have put in the last month, last year, how you are progressing with your weight. And with this, the personalized workout, the nutrition advice, the community support, all these applications, I would specify some applications in this session which are available in India and which are actually being used in a lot. It is mainly used by the nutritionist and also the diabetologist to promote different kinds of health education and awareness through these apps like Healthify Me, MyFitnessPal, Fitter, Fitso, Fitolo, etc. So, as if all know, these are all specific applications for health-based tracking. But there are broader health platforms like Google Fit, which also is in partnership with WHO, and we have the Apple Health. So these two things, which are integrated in our daily lives, also track our various health metrics and integrate with wearables. Whatever we are wearing, it is integrated with the health. So digital technology has gone into in such a way that our daily life is being monitored, and it has given us inputs that we should be doing such amount of calories, we should be burning such amount of calories, or the workouts have to be proper, you are not moving around in a day. So all these helps us in a broader sense. So AI WHO chatbot, which is called Sarah, was of WHO's first digital health promoter, which was released by WHO in the early 2020s. So now coming into the tools, which can be digital tools, which can be used for management. So what do you mean by management? This is basically after you are diagnosed of having a disease, a diabetes, you can track your health, you can track your disease progress, and also in that process monitor how you are progressing in the diabetes, whether it may be the diabetes values, HbA1c values, about your daily exercises, meal logins, all these things. And AI-powered diabetes management tools like Blue Star Diabetes, which is actually a well-doc company-based thingy. That is the only FDA-approved one. And there is another application called Tap Health. And there are many applications that has come out which actually is continuously connected to your glucometers. While you are using, as an diabetes patient, you are using your strips to monitor your glucose. See, these things can be connected to a digital technology. So AccuCheck, which is a famous glucometer provider, has started with a application called My Sugar, which helps in a gamified tracking. So there are also applications which are there in the glucose diary apps, which helps us to log what was our glucose levels all these years, or when our diabetes has started. We are using a particular diary and we are using it to record these things. So One Touch Reveal is one of the application, Contour Diabetes is another, Gluco, My Diabetes Meal Plan. All these things have helped in actually tracking what is your last glucose values for the last month, last year, or maybe from the start. So I would say that these kind of things are happening in the current scenario. So I would like to say some more applications which are associated with the management, like Glucose Buddy, Diabetes M, Gluro, and Beat O. All these things not just log your blood sugar, they also have your diet tracking, data reporting, and also the device integration, whether it is with your wearables or with your glucometers. So there is a new application which is called Under My Fork, which has come up, where you can even upload the photos of the food that you're going to take, and it will tell you the calories, so that it get merged with your continuous glucose monitoring values. So the digital technologies have gone in such a way that your live, whatever you're going to eat, that itself can be at a point controlled, or you can even monitor the values before you have that food. So let's move on to the next section. From the digital applications which are there in your mobiles, we are now coming to the section where we can wear them, like transcutaneous continuous glucose monitoring systems, which are basically sensors that can be attached over your skin, but it won't penetrate your skin. So this one of the famous one about Freestyle Libre 3M, and the other one is Medtronic Guardian 4. So these scans your arm for 24/7 glucose without any pricks. So this is one of the major 24/7 continuous glucose monitoring devices that is available in India. And there is a particular Indian company called GOQII Diabetic Cares Program, which is India's first diabetic care program, which was integrated with a watch, with a glucometer. And this company was specialized in making a diabetes care watch and a glucometer in India. And when I told about transcutaneous, which are over your skin as continuous glucose monitoring devices, there are also implantable continuous glucose monitoring, but those systems have not yet reached India. One of them is Eversense E3. And you all know that we all use smartwatches now, and smartwatches can track a lot of data from your watch through different sensors. And I would suggest that you have a good smartwatch which is at least able to track your systems properly. It can be Apple, Garmin, Fitbit, Samsung. All these are major players in the current field of biowearables. Now, moving on. So we have talked about the digital technologies that are available. There are there are biowearables that have come up in the digital technologies for prevention and management. Now we are talking about how the community can reach out to a particular self-service provider. And Indian government has been forefront in bringing such an application called e-Sanjeevani, which is now the India's telemedicine powerhouse. So this was launched as a national telemedicine service in 2019, and till February 2025, over 34 crore people have used the e-Sanjeevani. And what is the specialty of e-Sanjeevani? You get free remote consultations with both physicians and diabetologists. The diabetes prevention through Ayush OPDs, which are not just any other people. There are specialized people who are sitting for Ayush. You get lifestyle advices from these telemedicine consultations, and also you can do your early screening of the disease via video call with a health service provider. You can also do the management of your health diabetes current status through prescriptions with the diabetologist or a physician who is available over call. You can also share the prescription which was given to you by that person, by that doctor. You can give that prescription which is downloaded to the pharmacy and get your drugs. So you don't need to go to a physician or an endocrinologist every time, every month. So this is one of the major telemedicine achievement that has happened in India. And while telling about this telemedicine, I would like to focus on two things. The one is a rural focus of the telemedicine, where the travel from a rural place to an urban place for your consultations, for your needs, for health service provider access, that has been cut out by the telemedicine that has come up. And this has revolutionized access, especially for all the underserved areas in a country like India, where hilly areas, the rural areas, which are very far away from the health service providers, or they have to walk for kilometers to go to a doctor, all these have been cut out. And these telemedicine can work with a very meager amount of network. So that is another thing that is very important while we talk about e-Sanjeevani. And the whole process of e-Sanjeevani is very simple. You have to sign in. You sign up first with your mobile number. You have to log in with your same mobile number, and the OTP will come. You just have to give the major ailments or the problems that you currently have. You have to update the application with whatever prescriptions that you were having, whatever medications that you are currently having. Select which OPD that is available near you. Even you can call anybody in India. The doctors are available all over India, and you can initiate a video call or a chat to a health service provider and consult the doctor, download an e-prescription, get that e-prescription to a pharmacy, get the drugs for you. So it's that simple right now. So I would like to take you guys all through a small session, how you can register in the e-Sanjeevani, as I feel that this is one of the most important telemedicine or the digital technology that has been part of the diabetes prevention and management. So this can be used both in desktop and mobile phone, and you can use it in a browser in the desktop, or you can download it from the Play Store. It is a very user-friendly platform, and it supports multilingual languages. Also, there is round-the-clock services available, but I would suggest that you call in the morning, because most specialists are available in the morning slot. So now we'll just take a small brief look into how you can register yourself in the e-Sanjeevani, and you can just go and further do a video call with a physician or a diabetologist. So just type in e-Sanjeevani in Google, then you will get the website. So you can do the same in Play Store. You have to go up whether there will be a patient symbol, and you have to pull in the register part from there. And you have to, there are two options, whether you can proceed with your Aadhaar ID, which is Ayushman Bharat Health account, or you can provide without Aadhaar ID also, just by giving your mobile number. So I am going to proceed without my Aadhaar ID. I'm just going to put my mobile number here. And when you're putting your mobile number, you will be shown the OTP. So you will get the OTP, and that OTP will be valid for 15 minutes. You have to put in the OTP and just press submit, and then log in with that same mobile number to the platform. So this is how you will be logged in. And when first you have to complete your profile, I've just typed in my name. I am going to type in my date of birth, because date of birth gives you the proof how much old you are, and that is very important for a doctor to know your prognosis, how we can treat you. So give your date of birth. The mobile number will already be there. You don't have to provide your email if not needed. You have to provide your gender, then give the address line where you are from, which state you belong to, which district you are from, that particular state. So I would like to give Delhi for example. So I'm from East Delhi, let's say. So I'm saying selecting Mayur here, and block is not compulsory. You just have to give a postal code. So while saying about this, if you can see in the right top corner, you can see two options, A+ and English. So A+ is to increase the font size, and English is one of the support for all the languages that are available. Almost 15 to 20 languages are available in this platform. So you can not just use English, you can use Hindi, you can use Kannada, you can use Marathi. So I put in the login postal code and whether the question whether you have difficulties or not, and submit it. So this is the screen that pops up after that, and you have to just press the consult now. There are three major headings. One is dashboard, one is the past consultation, and other one is family members. So I'm just going to press the current dashboard, and I ask whether I am having a follow-up consultation right now or not. I've pressed no. So I've just pressed whether I have diabetes with problem. So the chatbot asks you, when were you diagnosed with the diabetes? I gave 2 years. So I am having type 2 diabetes. So I've just given whether I have family history or not, and I have to give the current health condition to the current treating doctor, and it will keep asking these kind of questions again and again. So to understand how your condition is, so it's an automatic chatbot. I gave my blood sugar level, so I don't have to fill the whole thing to move forward. You can stop at a point, but you have to give your chief complaints. You can give your medical history, you can give your personal history, whether you are an alcoholic, diabetic, and then your family history, whether your mother, father has a diabetes or not, then any allergy history, and what active medication that you are on. So for a diabetic patient, you may be in 1 or 2 diabetic drugs. So all those drugs are listed out there. You just have to type in, you just have to give the dosage which you are having, give the duration value, how old have you been having this diabetes prescriptions for, whether 1 year, 2 year, 1 month, how much it may be. So just add it there, it will come automatically. And then if you have any previous health records with you, you can download it as upload it as an image or a document. And what is your query to the current service provider that you have contacted? So whether you are I would suggest, like, I am having a dizziness right now, so I am a diabetes patient, and it's common that you can feel dizzy, and maybe I could say I'm also very tired at this moment. So you could ask whatever your query is, or you can ask, how should I follow up for the next this thing? And the next point is selecting where you want to consult. You can consult within your state, you can consult in the doctors in the neighboring state, or anywhere in India. So the fact is, you can talk in any language of your choice. You can select the language. If you are in Delhi, you can talk to a person in Tamil Nadu in Tamil by selecting this. So there are also affiliated hospitals and organizations like ESI, like AIMS, which are affiliated with this telemedicine platform. So I'm taking the state Delhi, and I'm going to select an OPD in the Delhi state general medicine OPD. So currently there are 3 doctors available, as you can see. Just select one doctor, and you can proceed further by initiating the video call. Just a button will come up in the right side which says call. So you can talk with the health service provider, and you can ask all your queries to that doctor, and the doctor will provide at the end of the call a prescription, an e-prescription through the digital technology platform. So this is about how you can download the prescription after your teleconsultation. Go to your past consultation in your main dashboard, click on the prescription icon in the right side. You can download the prescription, and this is how your prescription will be looking. And you can go to the nearest pharmacy and get the necessary drugs which are written in that prescription. And this, you have not gone to a doctor, you have just sit at your home, you have asked your query, the doctor has given your prescription, you can just go to the nearest pharmacy. So all the barriers which has to be taken when you are in a rural area, when you are in an underserved area, as overcome through this particular e-Sanjeevani. So now moving on, let's talk about how we can empower the community with the digital tools that are existing. So everybody has a WhatsApp right now, and most of us use smartphones. So these small tips and motivation that we get through WhatsApp groups is also using a digital tool for community empowerment. There are multiple health applications also which has app communities like Beat.org, Healthify Me. All these have app communities which can help you get connected and also keep yourself motivated. So what is the prevention part, that is diabetes prevention part, that we need to know is a risk awareness campaigns, just like how the day organization diabetes awareness and US providing so much of risk awareness campaigns through their portfolio. And there are so many NGOs that are giving preventions through the digital technologies. And also yoga sessions, the diet prescriptions that are available can be used for community empowerment. Also the group support motivation platform also needs to be taken into consideration when you are thinking about empowering a community, which is maybe your community or in a different community that you need to educate and make awareness for. So let's come down to the challenges that we have right now with the digital technologies in India. So digital literacy is one of the major challenges that have been blocking the penetration of digital technologies in India, in rural areas and among elderly especially. But as the smartphone boom has happened in this decade, the elderly people and the rural areas have more connectivity now, and the digital literacy has gone up in a big way. So the high cost of the devices that we use, like the glucometers that we use, which are connected to your smartphones, those devices cost have come down a lot. And the applications which you have using for your healthcare promotion, healthcare prevention, all these applications subscribe your charge, and those charges also have come down a lot due to a lot of apps coming in the market. So another one important challenge was the language barrier, and we have multilingual apps that are available. Just now I've shown the e-Sanjeevani application, which is having a multilingual support. And the ground level workers, the ASHA workers, who have been trained for more digital technology usage and how to promote the digital technologies among the normal communities. We have very cheap, low data options available with all the service providers, and also the telecom services that are being provided. So the government from their side has promoted digital services through different formats like Digital India, Ayushman Digital Mission, e-Sanjeevani. All these are very big examples how our government has tried to push the digital technologies for prevention and management of all the non-communicable diseases, especially diabetes. So let's call for an action today and at least have one app downloaded in our smart device. And if you are a person who is above 30 who are hearing me now, so get yourself screened whether you are exercising enough, whether your intake of calories is high enough. So get yourself screened and start prevention right now. And I would suggest you all to join in to the day.org.in and other groups, especially for these workshops and the resources that they provide for getting involved in a diabetes prevention campaign. And I would suggest everybody to empower yourself by trying one tool this week. So I would like to end my session by saying that let's empower India against diabetes with these digital technologies. Thank you all. The floor is open for questions, and you also can contact day.org.in for follow-ups.
Thank you, sir. Thank you so much. Indeed, a very, very enriching session. And I myself will download a digital app for sure. And we do have a question, I guess. Shukarnadi, do we have some questions?
Yes, yes. We have a few questions.
Yes, I would like to take them.
Yes, sir. Sir, are the mobile apps you have shown in the screen that are they really reliable for tracking diabetes and other disease and compared to the physical test run by the clinics?
Yes, so this is one of the common points. We are using these apps to track. So we are not using these apps to treat you. We are using these apps to track and monitor what is your progress.
Okay.
So
Yes.
you using your continuous glucose monitorings or your glucometers at home, when you're using it, you're reading, getting a value, you are logging it somewhere and getting that connected with your diet. So these things are very hard when you're trying to log it in a diary, when you're trying to write it down, when you're trying to calculate these calories. So I would say that these are basically apps are basically for tracking and monitoring. The treatment part will happen, I would say through the proper the doctor consultations and physical test.
So, like this is our for self awareness
Yes, absolutely.
to delay the complication and for prevention the disease or disorder. We have another question, sir. Thank you, sir. Thank you. To run these apps and tracking system, we usually need good internet connection. But for people who live in remote or rural areas where internet is not stable, how can they use these technologies for diabetes care?
So first of all, I would like to tell that these applications, many of them have become offline. That means you are able to download the app. You can keep it in your mobile. Whenever you get a good internet connection, it will sync automatically. And in case of e-Sanjeevani, yes, you do need internet connectivity, but it takes a very meager internet. And if you are not in a position to video call, if your internet is not well enough to provide a good internet connection, then you can always have an option to chat with the doctor in the e-Sanjeevani. So that is a very, very less data consuming application that the government has developed, especially for the rural areas and underserved people.
Yes, sir. Thank you, sir. Sir, see, add another question with that if she or he is not very updated, so how they can able to do that?
Updated regarding the technologies that are
Yes, I think so.
Yeah, so the digital technologies will keep evolving, and these kind of sessions which are providing these awareness, especially the NGO like Day, which is providing platforms for awareness. There are different government organizations and NGOs that are providing a lot of awareness campaigns regarding the latest digital technologies that are currently in the market. And also I would suggest that you can always try out with your mobile by downloading an application once. Try it out, see whether it works for you. If it's working fine, please stick with it, or else you can try another app always.
Yes, or we may go to the local health center to get the guidance from health worker.
Absolutely.
Yes. Thank you, sir. Thank you. Thank you, participants, for asking questions and queries. Thank you. Adit.
Okay, I think we do not have any further more questions, right?
Yes.
Okay, so
And
I'd like
if
to.
I request all the participants who are watching the program and in future who will watch the program, please write down in our chat box whether you have any queries. We will ask to sir and will give you answer.
I would be
Yes.
happy to answer those.
Thank you, sir. Thank you.
Okay, so I'd like to end today's session by saying, first of all, thank you, Dr. Krishna, for taking out time from your busy schedule and to be with us here today. We are very grateful to you for sharing your expertise and practical knowledge with us. It was an enriching session, an enriching experience that I have already said before. And we hope to see you soon and hope to see here with you, with us, our future sessions. Thank you once again for your valuable contributions. And I'd like to request all the participants, if you have any questions, as Shukanadi has said, please drop them in the comment box and we'll answer them. Okay, thank you.
Thank you.
Thank you, sir. Thank you. Good night.
Good night.